Hey, Phil Kaplan here with my partner, colleague, friend, Dr. Kristin Comella. Kristin, this is going to be brief, but I think it's important. We do a lot of informing people together. We do seminars together, podcasts, webinars. There's something that really you don't talk about as freely as you'd like. And I would say it's intentional because you're being careful. So when we do our podcast, we intentionally avoid this topic that is really so near and dear to not only your heart, but your career, your education, everything you've done professionally.
Yeah, one time somebody said, "Oh, well, do you know Kristin Comella?" And they said, "Oh, the yoga teacher?" And then the other person said, "No, the stem cell scientist."
And the truth is, they're both correct, right? Because you are both.
That's right. I am both.
You know, right now we're doing this very impromptu. I'm in my home. My daughter's bird is screaming. My cell phone is ringing. So this will be brief, but I just wanted to, for our Biohackers members, for our M3 audience, give people the inside scoop so they don't just believe everything they hear and read and all of the tweets, because you were on the David Knight Show on InfoWars, and I thought it was a really, really good interview. But as they are with many things, our population is very polarized based on who they listen to. So the topic, of course, we're going to talk about, I say of course because you know, stem cells. Just briefly, for those who don't know, talk about your background.
Yep, so I actually started in chemical engineering. My bachelor's and master's are both in chemical engineering, and I did a lot of work in the laboratory, kind of looking at the engineering of the human system. And really the greatest machine ever made is the human body. So if you can view the body almost as a machine and look at it like an engineer, you have an opportunity to learn something new that maybe doesn't come from a more medical perspective, but more from an engineering perspective. And I also have a PhD in stem cell biology. And as such, for the past 2 decades, have worked with clinicians around the world to address a variety of different medical conditions, anything from acute to chronic diseases. When I say acute, I mean more injuries. So say, for example, a meniscus tear in your knee. Chronic disease, anything from heart disease to lung disease to autoimmune. So the idea and the concept is that stem cells are inside every single one of us, and they're constantly at work. And we have this opportunity to tap into that unique healing potential that exists inside every one of us. And so we don't have to necessarily manufacture something in a laboratory, but instead tap into this potential that exists inside of us.
Is it fair to say that you are a researcher?
Yes, that's accurate. I'm a scientist. I've spent many years in a laboratory looking into a microscope and working with some of the best minds, scientists, physicians, clinicians in the world.
So if you go back in time to when you're going through that research and literally having discoveries, what did you see happening in your future? In other words, as you start to identify some of what the research has proven or what started to unfold, what did you see yourself doing?
You know, it was probably in 2000 that I had my first aha moment. So this is now 20 years ago. We were working on goats. Goats have a similar morphology in the knee joint, and we were utilizing stem cells from the bone marrow, injecting them into the knees of goats that had damaged knees, and then later looking to see if we had repaired any of the cartilage inside the knee. And so when we were doing the cartilage scoring to see if there had been any improvement, we remained blinded, meaning that we didn't know which ones we had given the cells to versus which ones we hadn't. So, you know, we created just kind of a numbering system so that we wouldn't know, so that we would then score those joints. When we looked in the joints, it was very clear which ones had received stem cells because there was new growth of cartilage there. And in 2000, it was just kind of a game changer for me. And I just thought, my God, this is going to change medicine. This is a big deal.
Goat number 7 got the stem cells from who?
The goats themselves. They were their own cells.
So the goat provided the cure for its own injury.
Correct.
So when you say we're going to change medicine, it's kind of like recognizing that you have the fix within you, assuming you're a goat. But perhaps this happens for people as well, right?
Yeah, and it was not long after that my focus really went towards the clinic and how do we bring these type of therapies forward to clinicians to give these to patients, and can we make this a simple outpatient procedure? Tissue out, tissue in. Tissue out, isolate your stem cells, tissue in a walkout procedure. And so I spent many years developing a protocol that would allow us to isolate the stem cells right there bedside to the patient, and immediately deliver them back. And we could have patients in and out in a matter of hours without any need for general anesthesia or hospitals or, and really trying to make this kind of a procedure that could apply to so many different applications.
There came a point that you were celebrated. Doctors who were progressive wanted to learn from you, and they did, correct?
Yeah, so we developed training programs for physicians and other clinicians who traveled to visit us from around the world. We probably trained almost 1,000 practitioners to utilize these protocols, and during that time, we treated more than 10,000 patients.
We hear stem cells in orthopedic applications. You mentioned knees. We've heard of that. We've heard of it in shoulder injuries. We've heard of it mitigating the need for surgery with joint issues and joint injuries. You went beyond that. I mean, you started to see some real change beyond what people expected even early on, correct?
That's exactly right. And the science is actually quite simple when you think about it. Disease has to do with inflammation. Disease also has to do with damaged tissue as a result of inflammation. Stem cells can address both issues. One, anti-inflammatory. That's how they work inside your body. When you create an inflammatory response, the stem cells come in and they shut that down. They tell the white blood cells, okay, quiet down, time to move into the next regenerative stage. And then they also address new tissue formation for damaged tissue. So being able to utilize these in essentially any disease, because disease has to do with inflammation and damaged tissue.
I want to lead to the point where I said you're celebrated. People are learning from you. I don't think there's anything in your rearview mirror that was showing you what's about to creep up on you, right? I mean, honestly, where we're going to go, and you know where we're going to go in this discussion, at a certain point, it was a hammer falling, correct?
Yes, it was.
You're seeing change. Talk about just specifics of what you actually witnessed, if you want to talk about individual cases or in research, beyond just joint healing.
You know, I would say that some of our most remarkable cases were actually in lung patients. And typically the patients that would present have something called COPD, or chronic obstructive pulmonary disease dysfunction. And what this is because of some chemical or environmental damage, it's often smoking cigarettes, there's chronic inflamed lung tissue. And as a result, you're not able to transport oxygen. And so these patients, there's no therapy that, can reverse this. Once you've gone down that path of chronic inflamed lung tissue, the only thing that can be done is to put you on oxygen. And once you get put on oxygen, your body says, oh, thank you, I'm going to stop trying. So just keep forcing oxygen. And so then you just have to up the oxygen more and more and more until, you're constantly hooked to an oxygen tank. And I think we've all seen these kind of people who are walking around hooked to an oxygen tank. And so
because what we believed that COPD was irreversible.
It's irreversible. Once you have COPD, that's it. So we would have patients, and look, when you're dealing with something that is considered new, the kind of cases that you tend to get are the ones who have exhausted every other opportunity or medical modality out there. They've tried every medication. And so we would get the very, very extreme cases. And I'll never forget the first COPD patient that we got. We were kind of split when we were deciding whether or not to treat the patient, because there were some scientists and practitioners in the room who said, no, we cannot possibly treat this patient because if they die, we will get blamed. And there were others in the room, myself being one of them, saying that if we don't treat this patient, this is ethically wrong.
I mean, it's the classic risk versus reward. Is it worth trying? Right?
Is it worth
That's the
trying?
question.
And so my feeling is a life is always worth trying. So, we did decide to move forward. And like I said, it was a split vote. But, we decided to move forward. Majority wanted to move forward with this patient. And this patient went from 24/7 required oxygen to coming off of oxygen, coming off of medications, the family saying that they've gotten their father back and they have more time with this person. And he lived for another 2 years after that. At the time that he presented, he was given weeks to live. So they got 2 more years, and you bet those were the best 2 years of his life. So was that risk worth it? 100% for me, and I would make that decision 1,000,000 times over.
Where did those stem cells come from?
From his own fat tissue. So we took a small sample of his fat. We isolated.
Wait, so you didn't purchase the stem cells anywhere? This had nothing to do with the human embryo. You took the stem cells out of his own body and put them back.
Yeah. And this is something that was done right there bedside. We isolated the fat just with local anesthesia he was remaining awake the entire time talking to us, and telling us about, all the things that he wanted to be able to do before he exited this life. And he wasn't able to do anything because he was stuck to an oxygen tank. He could barely move. Anytime he tried to go anywhere, the shortness of breath was unbearable. So, not only did we give him additional life, we gave him quality of life. And he was able to enjoy his family. As a matter of fact, he was able to walk his daughter up the aisle for her wedding. So we have a video of that. I mean, that's a big deal. That's a big deal.
All right. I don't want to name drop, and I don't want you to either, but I know there are many well-known people from many different fields that have been patients, that have gotten stem cell treatments, and that have brought their relatives for stem cell treatments. And we also know there are lots of people who go out of the country to Panama and other places because there are certain procedures that may not be approved here. But what's the rough number of people that you treated?
So between our specific clinic in South Florida and all the practitioners that have utilized our protocols, it's over 10,000.
That's not including the ones who went to Panama, right? You're talking about the ones that were touched directly or second or third generation through you, right?
Yeah. So utilizing our protocols in clinic, not including, Panama or any of the other entities that do stem cell therapies. I was just going to say there is another network that does a similar type protocol to ours, and they've also done more than 10,000 patients. So, the database of safety and efficacy is really growing.
Now, I think with any medical procedure, when you have 10,000 people, there are going to be a handful of adverse outcomes, especially when you're dealing with people who are high risk, or they're coming to you because they're sort of teetering a line between, in some cases, life and death. But is it fair to say, in your opinion, the adverse cases were few and blown out of proportion?
Yes, that's absolutely 100% accurate.
So now let's just briefly talk about when I said earlier the hammer fell. What happened?
In 2017, I received notice from my attorneys that the Food and Drug Administration had utilized their attorneys, who are the Department of Justice, and had drafted a lawsuit which read the United States of America versus Kristin Comella and the clinic entity, and that they were going to seek a permanent injunction, meaning that they wanted us to discontinue doing these protocols and procedures for patients. And that the reason they wanted us to discontinue is because what we were doing was considered a drug, and we didn't have the appropriate drug approvals in place, and that I had an opportunity to sign something called a consent decree, which states that I would agree to essentially go away and be quiet, and that they wouldn't bring that lawsuit, but that if I didn't sign the consent decree, that they would, come after me in this lawsuit as well
Kristin,
as other ways.
I don't know how long this conversation will live on through YouTube, but when we're recording it, it's in the midst of this COVID-19, I'll call it a panic. And, people are quarantined and people are sheltering at home. And that brought you to a place where they invited you back on InfoWars for this interview. Now, without getting into politics at all, it's fair to say that our population is polarized. Democrats, Republican, pro-Trump, anti-Trump, shelter at home, go back to work. I mean, these are really difficult battles that there's really, honestly, if you're in the middle, there's no clear answer which side you should listen to. But InfoWars invited you on because in the midst of this, people are dying from this disease, and they're dying because of pulmonary issues. And what are they looking for? The drug. Right now, because there's rumor that certain medications might have value in curing or treating COVID-19, people are hoarding these drugs. They're looking for the drug. What you're talking about is your own cells being reintroduced to your body. Where is the drug in this process?
Yeah, certainly my opinion is that the cells inside my body are owned by me. They are not owned by Big Pharma, and I should be allowed to use those cells how I so choose, and I think Americans also have that right. So if an American is having an acute respiratory issue as a result of COVID or any other, they should be allowed to utilize their own cells. We have published a study with regards to lung disease demonstrating that the cells can be beneficial, and it's kind of a no-brainer. It's an inexpensive type procedure.
When was that
something
study?
That can be done in clinics. That was published probably 2016, maybe.
Okay, so this had nothing to do with COVID. It's just now that there's a scramble going on. Somebody said, let's talk to this stem cell scientist who might have an answer to lung issues that was proven in research. So here's the big question. Can stem cells really play a part of the solution in saving lives or mitigating illness in the midst of this pandemic?
Yeah, I think they could. The challenge is for us right now is the regulatory restrictions that are put in place, and the problem is that it's not something you can bottle and patent or mass produce. So there would be a lack of funding to, study or go through the large double-blind placebo-controlled trials that are required for drugs. But surgeries don't go through large double-blind placebo-controlled trials. These are just done by physicians, and if they work, people keep getting them. If they don't work, then those surgeries don't happen anymore. But there's nothing to bottle and sell.
I thought it was important for you and I to have this conversation that people can eavesdrop into, because I don't want anybody to think that Dr. Kristin Comella is now waving the banner going, stem cells are the answer to COVID-19. They came to you. You're not out there promoting anything right now because you, in essence, have been shut down.
Yeah, so, the clinic is still operating. We are able to do a lot of different procedures, and help people in a lot of different ways. We can do some stem cell procedures, just not the way that we would prefer. And, I'm not making a big fuss about it because right now I am still in an appeal trying to get the rights of Americans back.
So, Kristin, I've come to know you pretty well, and I have to say that I know your passion. I know your intention. I've seen your work. I understand your scientific mind. None of this has been selfish on your part. And if you have an opportunity to save the world, you would do it happily. I mean, I can tell anybody stories just about what I've witnessed, about the lengths you've gone to help people. Mm-hmm. So I don't want anybody to be confused by who Dr. Kristin Comella is because they read a tweet or they read something that's biased or they read somebody's blog. I wanted people to have a chance to just kind of hear where you're coming from and what this is before they start to judge some interview or somebody else's opinion. So to give people clarity as to what we're talking about with stem cells, I want to go back to something that we probably said 4 or 5 times, but it bears repeating. These are your cells, and we all have them, correct?
Yeah, they're constantly at work inside your body. You actually have stem cells in every single tissue inside your body. They're turning over the tissue when it gets exhausted. Like you have constant turnover. I mean, even just, you talk a lot about fat tissue. We used to think we had a set number of fat cells or adipocytes, and they would either grow or shrink depending on how many times you visited McDonald's or your adrenal stress. But that's not true at all. There's constant turnover, and your stem cells are always replenishing the adipocytes in your body. And that's happening in every single tissue. So why not utilize this technology that's inside you? It's the perfect technology.
Come back and reemphasize that they're your cells. Again, because while everybody's clamoring to find something synthetic or manufactured or something that is a drug that they could repurpose for this, I'd have to ask you the question, is this as natural as it gets?
Yeah, it's the ultimate natural hack. It's so perfect. And a lot of times people will say to me, well, I'm too old, so my stem cells might not be good. And I said, no way, you're standing here talking to me. Your stem cells are fabulous. They're hard at work all the time. And I know because I can see you breathing and I can see you talking to me. So your cells are amazing. They're inside you. We can use them to help you.
You've put your own stem cells back in your body, correct?
That's correct. I can't think of many people that I know that haven't. Most of my family and my friends, because there's going to be a moment when you need your cells. Even my son has done it. My son, who is 18. But there's going to be a time that you need your cells. So, you get a knee injury, or maybe you've got something going on chronic that you're not able to overcome. You can utilize your cells to help you through that process. Sometimes you need a boost. Again,
without getting too deep into it, it's fair to say that in your opinion the controversy is unfair and based on bias. And I think the clear example of the bias is you didn't have your day in court.
Yeah, so when the original lawsuit was brought, a week before we were set to go to trial, the judge canceled the trial, and she awarded what's called summary judgment to the government. She cited something called our deference, which states that regulatory agencies will interpret their own laws, and the federal courts would defer to the regulatory agency. So instead of hearing both sides and allowing us to speak our case, she deferred to the federal government and sided with them. So this practice of deference is really an unfair advantage to the federal government against the people of America.
If you could make one statement that you want people to know related to stem cells, looking forward and believing the day will come, they will have access, what would that statement be?
Yeah, stem cells are the future, and they're here right now. You should all have access to your own stem cells, and this is not something that should be withheld in the interest of money. And I think oftentimes it does come down to that. And there are many other countries that have embraced the concept of using your own stem cells, and America should not be late to that party.
Most of the time when we do our podcast, it's really just a conversation between you and me, but this felt more like an interview intentionally. But is there anything you want to say that I didn't ask you?
I just want to thank everyone for their support. When I first got the lawsuit and decided to fight, I knew it was going to be a tough road. I knew that I would, be criticized in the media. I knew that the media would not be fair. I knew that they would say things that were taken out of context, and the battle is well worth it. I know what I'm standing up for is the right thing, and I know that in the future, it will be known that this is the right thing, and this will be standard.
We work together to help people become their best, to reverse chronic disease. We do this through what is called biohacking. We also do it through helping people optimize the brain, the immune system, the gut, mind, spirit, and cell. Kristin is not a yoga instructor who just ran around randomly injecting stem cells in anybody. Kristin is a stem cell researcher and renowned scientist who also has a tremendous passion for fitness and yoga and mindfulness and health and getting people well. And I'm thankful that you and I have the opportunity to do that together right now. And as I said, people may be hearing this a year from now where they go, what's COVID-19? That's my hope. But right now, you can't turn on the news or open any website without seeing notices about what's happening and shelter at home. And people are afraid. And you and I together did a very important webinar with Dr. Bleiweiss sharing some truth. And I think if we had to encapsulate the truth, it's that you have the power within you to overcome disease and to heal. And if anybody hasn't listened to that webinar, they should. So you can go to YouTube and just search for M3, which is our podcast, Mind, Muscle, and Medicine. And Kristin, I think all of the controversy right now is leading to the point where ultimately there's a massive breakthrough and people come to understand the science that you've contributed to. And they find that their own power to heal, whether it is through changing the way they eat, changing the way they move, changing the way they breathe, exposing themselves to negative ions or infrared light, or utilizing their own stem cells, the power ultimately is within all of us. People just have to learn to access it. And I think the saddest thing of all is people become victims because they expect something outside of themselves to rescue them.
That's right. I mean, the power to heal is inside you. Sometimes I'll ask people, who's going to heal you? And oftentimes they'll kind of look at me and I'm like, you're going to heal you. It's not a magic pill. You're going to heal you.
It's really cool that the actual science that you've studied proves that people are looking to science for the rescue, and what you've uncovered is the rescue is you.
That's it. I look forward to meeting each and every one of you, and we got a lot of work to do.
We do, and we're doing it, and this was a part of it.
Yeah, thank you.
Bye, everybody.